Good morning, everyone, and thank you for joining us today. My name is Sean Horrigan. I'm a Marketing Communications Associate with Commonwealth Purchasing Group. For those of you who may be unfamiliar with our program, we are the leading group purchasing organization for community health centers and other nonprofit organizations. I encourage you to visit our website at cwpurchasing.com to learn more about how we can help your organization save money. Today, we are very excited to have Kurt Bodstubner, Enterprise Specialist with Midmark Corporation, here to discuss Better BP is Better Care. Let me tell you a little bit about Midmark before I introduce you to Kirk. Midmark helps physicians and care teams deliver exceptional patient care with better equipment, smarter workflows, and integrated technology. For more than 50 years, Midmark has used knowledge and understanding of the ambulatory care space to help customers improve clinical outcomes and eliminate barriers that prevent a seamless, well-coordinated patient care experience. Midmark offers full lines of exam and procedure chairs, workstations, cabinetry, instrument processing, diagnostic instruments, and digital diagnostic solutions, as well as expert consulting services. Kurt Bodstubner has been associated with Commonwealth Purchasing Group for more than 30 years in various roles, both with McKesson Corporation and Midmark. He is responsible for ensuring CPG members adopt new methods and technologies that lead to better patient care. Kirk is a graduate of Bentley University in Waltham, Massachusetts. Today's webinar is designed to last for about 20 minutes for the presentation and around 10 minutes for Q&A. If you have a question, please type it into the chat and I will be sure to share it with Kurt at the end of his presentation. At this time, I'd like to hand it over to you, Kirk. Thank you for being with us, and why don't we get started?
Thanks, everyone. Thanks, Sean. Glad to be here today, and I hope that some of this information is informative and insightful and actionable for you as you leave here today. So let us begin. Today, we're going to talk about the projected growth of outpatient services and the impact of blood pressure measurements on patient care. We're going to talk a little bit about considerations for process improvement. And we're also going to talk about a CEU program to help maintain clinical competencies for clinical staff. By 2029, outpatient visits nationally will total 2.5 billion visits. That represents double all of the other visits and other points of care combined. And blood pressure measurement is obviously done in all points of care. So blood pressure accuracy in primary care is critical to managing care before hypertension-related illnesses can result in critical care and added cost to the healthcare system. When we look at chronic disease, such as heart disease, cancer, and diabetes, not only are they the leading cause of death and disability in the US, but they are also the leading drivers of the nation's $4.1 trillion in annual healthcare costs. Nothing kills more Americans than heart disease and stroke, and tens of millions of Americans and adults in the US have hypertension, high BP, and many of them do not have it under control. Preventing chronic diseases or managing them when prevention is not possible can reduce these costs. Validated data suggests that 20 to 30% of hypertension is misdiagnosed. This equates to 1 in every 5 patients and also results in unnecessary labs, prescription tests, appointments, and less time with your provider. Validated data also suggests that there are 18 factors that affect blood pressure readings. The red items refer to factors that can be addressed through proper process and technology improvements, and the blue items refer to factors that can be addressed through proper patient positioning. Along the bottom, you can see a range of error that each of these factors can have, And although these factors are not additive, each factor alone can contribute to inaccuracy. As you can see by the bars to the right here, most of these factors result in an overestimation rather than an underestimation of blood pressure readings. So in 2017, the ACC and the AHA published new guidelines emphasizing the importance of using proper technique for measuring blood pressure. Proper positioning alone can have a dramatic effect on BP measurements. Now, exam room design and equipment can also contribute to blood pressure measurement variances as well. So again, as we look at this image, you will see that there are a number of factors in this exam room design that affect to inaccuracies in blood pressure measurement. For example, using an exam table, the feet may not be supported, the back may not be supported, and the arm may also not be supported at heart level. All these things affect the blood pressure readings. Of course, high readings also need to be repeated before the end of the office visit, which takes more time and adds to the inefficiencies in patient flow. As patient volumes continue to rise, it's imperative that clinicians make the most of their time at the point of care, and the right combination of equipment, technology at the point of care can improve patient care, outcomes, and improve care flow. Today, more diagnostic testing is performed at the point of care than ever before, and the integration of these workflows into the exam room can be highly variable. Manual methods of testing and manual data entry can lead to errors as well. Common errors like transposing numbers of a blood pressure of 119/80, for example, could be entered into the computer as 191/80. And studies have shown that as much as 17% transcription error rates are associated with entering data manually into an EMR, which can lead to misdiagnosis, a missing diagnosis, or an overtreatment or undertreatment of the patient. Modern vital signs machines offer features that can improve accuracy as well. They can also connect to the EMR to automate the documentation process. This saves time and eliminates transcription errors. And in this example I'm sharing with you today, it shows how an Epic user can import the vitals data with just a few clicks with an integrated vitals device. And finally, as you look at the modern exam room design, it features equipment that helps to standardize the process and the positioning necessary for the most accurate blood pressure measurements. The exam chair, for example, lowers so that 97% of adults can be positioned with their back and feet supported. In addition, the armrest pivots up so that the patient arm is supported at heart level. And last, the vitals machine connects to the EMR so that the blood pressure data, as well as other vital signs such as pulse oximetry, heart rate, temperature, and even the weight captured from the exam chair, can automatically be documented in the EHR. This is referred to as a connected point of care ecosystem. So to close on this, innovations in the exam room design and equipment and technology can help reduce manual errors and contribute to the overall reduction in the total cost of care. And of course, one of the best ways to improve accuracy in blood pressure measurement is to ensure clinical staff have the awareness they need to avoid many of the factors we discussed today that contribute to inaccuracy. So we're happy to share with you that Midmark is sponsoring a program that can help improve blood pressure measurement in the outpatient setting. This 2-hour CE program is now available for CPG members. The first 30 minutes is a group meeting to watch content pre-recorded by an expert in hypertension. That's followed by a 90-minute self-study online course with an assessment to receive credits. And for more information, you can certainly reach out to info@cwpurchasing.com. So with that, Sean, that's the content we plan to share with you today, and we can certainly open it up for any questions.
Well, thank you so much, Kirk. That was really an enlightening and engaging presentation, and I appreciate that. Uh, So as Kirk mentioned, if you have a question, please type it into the Q&A chat, and I will be sure to field it to Kirk. And if you're not a CPG member yet, I would suggest that you contact us to learn how you can save on working with companies like Midmark and more. But if you have questions in the future, be sure to reach out to us here at CPG. At info@cwpurchasing.com, or reach out to Kirk directly, and we will be sure to answer them for you. And I would like to thank everyone for joining us today. And Kirk, I especially would like to thank you for sharing your wisdom and expertise. This has been really terrific.
Very good. Well, thanks for having us.
My pleasure. Thanks for being here.